So hi, I'm Lori. I'm a pharmacist at Shaver Compounding Pharmacy. Hormones have been my passion for about 30 years. I was first introduced to them during pharmacy rotations. I was at a shop in Spokane and we made little progesterone hard candies for women just for PMS, just to take the edge off. I got this, I'm not gonna rip your head off. So ever since then, I've always been interested in hormones and how they affect us. So tonight we're going to talk about the emotional and psychosomatic effects of our 28-day cycle. And then on top of that, we're going to get a little bit complicated and talk about how that changes during perimenopause, what to look out for, how to react, symptoms, all of those different things. So this slide is a picture of our 28-day cycle in terms of the two main hormones that rule our lives, estrogen and progesterone. So follicular phase, day one is the day we start bleeding. Period starts, you're like, oh, I smell myself. Oh, I feel gross. Oh, I just need to shower. Oh, yuck. Second week of the month, estrogen starts peaking, getting ready for ovulation, and progesterone's still low here. During this phase, you guys know what the circadian rhythm is, right? The circle the day. We have an infradian rhythm, which is part of our menstrual cycle, is part of that infradian rhythm. So it's longer than a day period. So our menstrual cycle is in that. During this time period, estrogen peaks, we have ovulation, and progesterone's still low. Then we get into the luteal phase where estrogen does a little drop, progesterone goes up, and the cycle starts over again. So this is what happens in a normal 28-day cycle. When we impose that on the, oops, wrong one. When we, there we go. When we think about what's happening emotionally, here's what's happening. First week of the month, you start to bleed. Oh, I smell myself. Oh, I feel gross. Oh, I'm just tired. I just need to shower. Yuck. Those first 2 days are probably days in terms of exercise that it's not a bad idea to just kind of take a breath, let yourself bleed and get through it. And then things start to change, right? That estrogen's slowly going up, progesterone's still a little bit low. We feel a little bit better. We feel motivated. Got a little bit of late day bloating, a ring around our ankles where our socks were, these weird headaches that can kind of show up. So cyclical migraines are often during this time of the month. Breast changes, breast tenderness, breast fullness. When estrogen is high, things are puffy. So in general, we're all built a little bit differently. Women who are more progesterone dominant look like Cameron Diaz, Kate Hudson, Gwyneth Paltrow, right? You have a very physical image. Women who are more estrogen dominant, women who are overweight, have 40% higher levels of estrogen than women who are normal weight. So those women who are estrogen dominant, or you might have heard PCOS is an estrogen dominant thing. They look like Kim Kardashian, Sofia Vergara, or Oprah, right? We got curves and boobs and we got stick straight. So two completely polar opposite body types on the big ends of the bell curve, but we're just a blend of all sorts of that. So nobody's going to go through the 28-day cycle exactly the same. We know what's supposed to happen, but just endogenously, we either are a little bit more estrogen, a little bit more progesterone, or kind of somewhere in between. Third week of the month, we're like, all right, I feel better. I don't feel too bad, but I want chocolate. I need chocolate and I need chocolate now. I'm craving carbs. So what's kind of happening here is things are starting to wiggle around and you're like, you know what though? I feel better and my husband looks good for a day or two. You're driving to work, you're listening to Caleb, or you see something on TV and you start crying for no apparent reason. And then you want to dig into the bag of Lay's potato chips dipped in ranch dressing or popcorn with lots of butter and salt. And then a few days later, you're like, but I feel fantastic. Like, I feel like I could conquer the world. I have this list of all the things to do. It's September and I've got to get the harvesting and I got to get my canning done. And I'm going to go for a run and I got to get the kids from soccer and I'm going to do all these things. I'm going to have everything done and I feel fantastic. So what's happening here is that progesterone is kind of over the estrogen phase. So if you've been pregnant, that second trimester is when progesterone is really high and estrogen's a little bit lower. And that's usually the, yeah, I am going to completely gut this room. I'm going to make the nursery. I'm going to make the bed. I'm going to do all of these things. because that progesterone is a little bit higher. When we look at, things go clear back to the hormone pathway. And this rules our lives. And I don't know if you guys have seen this before or not. Other things that rule our 28-day cycle and affect our 28-day cycle are cortisol and insulin. Cortisol is our stress hormone. Cortisol is good to have. We have to have it to live. But cortisol is also that, oh my gosh, it's September and I don't have these things done. And I got to get the kids to soccer and I got to get to football practice. And what am I going to do? How am I going to get to exercise? Am I going to exercise while they're at practice? What am I going to do? I got to get dinner on the table because we have to all eat dinner. And I had to work 60 hours this week and I got this big project. And how am I going to get that all done, right? So that's cortisol. And when your cortisol is really amped, you start to gain weight. You become insulin resistant. All of that then affects everything else. So when you think of the hormone pathway, you think of this as an orchestra, and every hormone is an instrument, okay? They all have to play together for the music to sound good. So it looks really confusing, but it's not. So cholesterol, we have to have, our cholesterol has to be about 140 for everything to work down the pathway. Most of these hormones are produced in our ovaries as women. Once our ovaries are either taken out or they stop working, a lot of it's from our adrenals, which is also where we make a lot of stress, okay? So when we think of this as an orchestra and every hormone's an instrument, they all have to play together for the music to sound good. These arrows are enzymes that help with conversion from one hormone to the next. And they're mitigated and helped by things like indole-3 carbinol, which is found in cruciferous vegetables. During the first half of our cycle, the follicular phase, eating more raw vegetables can be more helpful in preventing bloating and stuff, as opposed to the luteal phase of our cycle, the second half, where more complex carbs, maybe cooked cruciferous vegetables are better that way. But those cruciferous vegetables contain indole-3 carbinol. Can you have enough from cruciferous vegetables? I mean, if your diet is good, if your lifestyle is good, clean and green, all of those things, maybe, but maybe you need a little help and maybe you need a supplement. Zinc helps with all of these things working together too. So if you look, and we have cortisol right here, and there's no arrows, if they're the drums and they're beating twice as fast as everything else because of all those things they have to do, blah, 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 you need to tell the drums to slow down or tell these guys to play faster or differently so that the music sounds good. It's a very dynamic system and it changes every 28 days. And then it really changes during puberty and perimenopause. So keeping stress down, number one, is always super important. All right, so let's go. You guys have any questions on this? So interestingly, part of this infradian rhythm, during the follicular phase, when our estrogen is a little bit higher, if you're an athlete, this is when you might feel like you can do cardio and you're like, I can run, I feel fantastic, everything's going great. And then you get here in the luteal phase and you're still doing cardio, you're training for a triathlon, you're doing all those things, and you've gained a little weight. You're like, I don't know what's going on. I don't understand it. What's happening? During the follicular phase of your cycle, we probably need about 250 calories less on average than in the luteal phase. So a little bit lower calories here, a little bit higher calories here. But again, this is where you feel absolutely fantastic. You're running great here. You feel a little sluggish here. Okay, does that make sense? So that's the 28-day cycle normally. Then we get to this. And this is where things get all wonky. Now remember that 28-day cycle is supposed to be for everybody who's normal. But if you're more estrogen dominant, your progesterone doesn't come up during that last half of the cycle, you have what's called luteal phase defect, and it might be really difficult to get pregnant or maintain pregnancy. If you're more progesterone dominant, oof, I didn't even know it was that time of the month. Oh, I'm pregnant. All I had to do was think about sex. And there it goes. So just again, endogenously, we're different. Now we get into puberty and perimenopause. So if you're a mom and you have a teenage daughter at home, perimenopause is typically 3 to 5 years that we really notice the symptoms, anywhere from age 35 to 55. So if mom's in perimenopause and daughter's in puberty, man, the hormones in the house are a mess, right? They're all over the board. So puberty is 1 to 3 years, and what happens there is that estrogen does this crazy up and down, while progesterone through a life cycle does a slow up and slow down, okay? We get to perimenopause and estrogen does this crazy thing again. I think I realized that this was some of my high school teachers, that it was like a Dr. Jekyll, Mrs. Hyde sort of thing, because I think they were here when we were here and you had no idea who was going to show up on either case any day. So puberty is at 1 to 3 years, perimenopause 3 to 5. Here's childbearing years, and typically we feel pretty good. Typically, the progesterone to estrogen ratio is a little bit greater progesterone to estrogen. When we go back again to the first picture, you can see the progesterone to estrogen ratio is really low here, right? Estrogen is greater than progesterone. Then we have progesterone higher than estrogen, and then it drops again. So we feel typically through our life cycle that progesterone is a little bit higher than estrogen over the course of everything. But we get here, and what happens is all of a sudden you're done having your babies, your 30s and 40s, late 20s, you feel absolutely fantastic. You can sleep 5 hours, you can have everything done, you get your house painted, kids are everywhere, and then you hit perimenopause and it's game over, and you wondered how you raised your kids. Your ovaries are like, you know what, we're tired, we don't want to do anything anymore, it's game over. So estrogen drops. And when estrogen is low, everything is dry. Vaginal dryness, dry hair, dry skin. And you walk into a room and you're like, oh, what did I come in here for? If I go back out, come back in, will I remember? Honey, can you get the ketchup out of the vinegar? The ketchup out of the refrigerator? You put the peanut butter in the fridge, you put the milk in the cupboard. You're driving to Costco and realize you're at Walmart. You can't remember your neighbor's name. They've been your neighbor for 20 years. You know their garage code. You can think of their license plate number, their phone number. But oh my gosh, what is her name, right? So when estrogen is low, we're kind of stupid. So in our brain. No. So, but when you think about it, right, it's Alzheimer's is a lot of different things. Alzheimer's is a blood sugar issue. Alzheimer's is diabetes type 3, but twice as many women as men have Alzheimer's. And a lot of times it's that sharp decline in estrogen. So women who have gone through menopause that are untreated with hormone replacement therapy may have, estrogen, we'll go back to this guy and then I'll come back here. Estrogen is heart protective. It's why women after menopause without hormone replacement therapy have an higher incidence of heart attacks. It's why women after menopause without replacement have higher incidence of Alzheimer's. Estrogen also stops bone loss. Progesterone protects our breasts. So sometimes when we look at, I have a chart that you guys are welcome to. When we look at insulin resistance is often a case of excess estrogen, excess androgen, maybe some PCOS. And what happens is that leads to increased risk of breast cancer. So a larger number of overweight women, typically, just in general, may have breast cancer because it's kind of an estrogen dominant thing. If our liver isn't functioning properly, if you haven't talked to Christine about a liver detox and we're going down some bad pathways, we get a increased risk of cancer. But estrogen by itself is brain protective, heart protective, stops bone loss. Progesterone is breast protective and builds bone. I like to call this the bigger, stronger, faster pathway. Progesterone converts to testosterone. And so during this part of our cycle, when we're having normal cycles, when progesterone is low and estrogen is really high just before ovulation, we are more at risk for injuries. So if you're an estrogen dominant person, and this is really super cool. I talked to a orthopedic surgeon about this one day. I said, all right, so I've heard this. What do you think? And he said, no, Lorri, I see more female athletes during the first 2 weeks of the month. And that also includes postmenopausal women because we have an increased risk of frozen shoulder and we tweak our knees and different things like that. So when I looked at my daughter, who was an athlete, couldn't play D1 soccer, was a mogul skier. She's very much a progesterone dominant person. She never had any lower limb injuries, and it was typically the bigger, stockier girls that always had knee braces on, that were blowing ACLs, MCLs, that kind of thing. So that more estrogen dominant person in general typically had more injuries as opposed to someone who's a little bit more progesterone dominant, and that connective tissue, that progesterone to testosterone tendons of ligaments are a little bit stronger. So it's really kind of cool. All right, so let's go back to what happens here, and we're all messed up. We want to keep our ovaries as long as we possibly can, because keeping our ovaries keeps these hormones going. But like I said, estrogen drops, we're stupid, everything. Our brain then tells our ovaries, all right, you need to kick out some estrogen. Dance is not over. We've got to have this. So all of a sudden, and all of a sudden is not like the next day or the next month. These changes are 6 to 12 month changes, because this is a 3 to 5 year period. So all of a sudden, our ovaries kick out a ton of estrogen, and then estrogen is high and progesterone is lower. So we go back to what happens when estrogen was high and progesterone was low. Here was that second week of the month, right? Feel a bit energized, kind of motivated, some late day bloating, headaches, breast tenderness, breast fullness, weight gain. Literally, you can step on the scale at night and step on the scale in the morning, and you're like, I didn't eat or drink anything and I gained 3 pounds. What the crap happened? So that's that really high estrogen level causing that. So when we're in that situation where we have really high estrogen and low progesterone, those symptoms get exacerbated. You have really heavy periods for 3 to 6 months. You have breast tenderness, breast fullness. You have weight gain. All of the symptoms that go along with high estrogen and low progesterone. But we still have this 28-day cycle. So we get real messed up when this is happening and we're in one of those really high estrogen spikes or a drop. We just have to learn to understand our body and ourselves and what metabolic changes are taking place, what foods make us feel better, what foods make us feel worse. Typically strength training every day of the month is fantastic, but maybe you should only do cardio here. Maybe you go back to walks here, switch it up, that cross training. I was listening to a podcast recently and they were talking about like the HIIT. A few years ago it was HIIT training, 30-second sprints and intervals and all of that stuff all the time. Well, those studies for HIIT training and the keto and paleo diets are based off men, and their hormones don't do this, or postmenopausal women, and their hormones don't do this. We're flatlined. So when you're in this, you really have to kind of keep a journal. There are apps out there that can help you map your cycle, and the other things that go along with it in terms of moods, in terms of exercise, in terms of foods, and the things that make you feel better. So we'll go back here. This just continues up and down, up and down, up and down for 3 to 5 years until both our ovaries and our brain are like, okay, we're done. But the symptoms that get worse this whole time period, hot flashes, night sweats, bone loss, mood changes, crossing your legs when you laugh or sneeze, I gotta run to the bathroom, really heavy periods for 3 to 6 months, really light periods for 3 to 6 months, period lengths changing, cognitive function declines. Interestingly, during this time of the month, when estrogen is high, is when you kind of are like, I came up with this great idea and I've got everything detailed out and we're going to go on this trip and I have everything planned. And during this time of the month, you say, well, okay, I know you have everything planned, but let's look at this from another viewpoint and let's make sure that everything is absolutely correct. What happens if this? Well, I don't know, because everything's going to be perfect. And this person's like, oh, great, I think that's a great idea. I can help you with this. I can help you with that. I've got all of this kind of energy. I didn't come up with the idea, but I can help you get through it. So our cognitive function also changes here. And then again, here. So always thinking about those estrogen and progesterone ratios and where they are in our 28-day cycle and then also as we go through the perimenopausal journey. The Japanese call menopause the second spring of life. I can't remember the name, but it's a chance for rebirth and regrowth. You've had your babies, it's time to bloom, it's time to cherish who you are and be aware of yourself and all of those kind of things. So it's not a chance when somebody says to you, oh, you're old, you're just getting older, it's fine. No, I don't want to grow. I don't want to grow old. I want to grow. I don't want to get old. I want to grow. It's your chance to learn a new language, to travel to countries, to do all of those other things that you can do. So as we go through that perimenopausal change, it's nice to know the symptoms that are happening. So when you're in one of those estrogen high periods and progesterone low, the symptoms are very similar. So it's water retention, breast swelling, craving sweets, craving carbs, fibrocystic breasts, right? Estrogen is high, everything is kind of puffy, nervous, anxious, heavy periods, fatigue, weight gain, symptoms of low thyroid, which we also have to keep in play. And when progesterone is low, same things, headaches, anxiety, irregular menstruation. Progesterone is my absolute favorite hormone. Again, when I started pharmacy school, we made progesterone candies for women just for PMS, just for that time of the month when you're stopping to rip people's heads off. And then again, sometimes I use it cyclically for women who have cyclical migraines and they occur here. You might have other symptoms of like cramping, maybe a little spotting sometimes here. That can happen as well, especially during that perimenopausal change. But progesterone orally converts in our stomach to a hormone called allopregnanolone, which has GABA receptor activity. GABA helps with relaxation. So you're 45 years old, you're still having cycles, they're changing. And Suzanne Summers, bless her heart, called menopause the 7 dwarfs of menopause: itchy, bitchy, sweaty, sleepy, forgetful, and all dried up. So a lot of divorces happen in this time period because we don't understand what's happening. They don't understand what's happening. Everybody butts heads. Knowing what's going on, or your moods change. Again, you're anxious, you're nervous, you're irritable, you have weight gain, mood swings, you can't sleep, you have low libido, depression, PMS, fuzzy thinking, joint pain. When estrogen is high and progesterone is low, and you go to the doctor and they're like, oh, you're probably just depressed, here's an antidepressant, and you're not sleeping, here's a sleeping pill. I wish more women would get baseline hormones done when they were 30, at least 40, and then continue to go from there, knowing where you are in your cycle. Because again, everybody's so different. You're either, more progesterone dominant, more estrogen dominant. But progesterone orally helps with sleep. And so what we can do with that is, if you're still cycling, we can cycle it. You can do 1 dose here, double the dose so say you do 1 capsule days 1 through 13, 2 capsules days 14 through 25, off 3 days, have a period, and repeat. So that is amazing in terms of helping with sleep. If we're kind of in one of these crazy changes and that estrogen is really high and that progesterone is low, maybe you have to do progesterone orally every day to help with sleep. It's just everybody is so different, and you're the captain of your ship. So let's go back to here. When estrogen is low and progesterone is high, right, that's that other swing. Estrogen is low, everything is dry, vaginal dryness, yeast infections. As you go through perimenopause and we're in those cycles, if you notice more yeast infections, elderly women are going to have more UTIs. And when an elderly lady has a UTI, often it presents with hallucinations and paranoia or delirium. So you as a child are like, oh gosh, mom is going crazy. What is it? You go to the ER and find out it's a UTI. Well, as we age, vaginal dryness, estrogen, right, makes things puffy, right? Estrogen is Sofia Vergara and Oprah. When that estrogen is gone, all those cells in our vaginal area turn into little teeny tiny raisins, shriveled up raisins when our estrogen is gone. When we add estrogen back to that vaginal area, it's kind of like the Arizona desert when the spring rains come, and all of a sudden there's no cracks in the desert and the cactuses are blooming and all of that stuff. So estrogen in our little vaginal desert makes those raisins turn back into grapes. And so what we like to do with that is make sure we have some estrogen in that area. DHEA is another hormone that has muscarinic activity, and that will help with some of those bladder incontinence, crossing your legs, the urge incontinence or stress incontinence kind of things. But keeping that estrogen back in there, watering those plants, getting those raisins back into grapes. We like to do it maybe every day for 2 weeks, and then we switch to just watering the plants maybe 3 to 5 times a week with a little bit of estrogen and DHEA or testosterone or progesterone cream. We can kind of mix and match, just depends on what you need. So estrogen is low, everything is dry. When progesterone is too high, which it could be if you're taking too much, or if you're really in one of these bigger swings, but remember, progesterone is slowly declining, but then on top of that, we have that 28-day cycle. So if progesterone is super high and estrogen is really low, there's those other symptoms. Tired all the time, mild depression, there's candida, right? There's yeast infection, same thing. Bloating, breast swelling, it just, those two kind of go together, and those two go together when we feel absolutely terrible. So knowing that they're changing is super important. We'll just touch on testosterone. Our circadian rhythm doesn't really, our testosterone doesn't typically change, but I want to touch on it for a second because 75% of women are testosterone deficient. A lot of it has to do with our lifestyle and exposure to toxins and environmental obesogens and endocrine disruptors. We are exposed to every 30 days more than our grandparents were exposed to in their lifetime. So when you look at the nanoplastics and everything else, when you walk on carpet that is flame retardant and you're barefoot, when you walk on the grass after it's been fertilized, all of those things you're absorbing. You're drinking nanoplastics are everywhere now. They're finding it in umbilical cords. So all of those things are endocrine disruptors, which messes with the hormone pathway, and that has to do a lot with the testosterone deficiency. Besides the fact that we're not moving, we're not eating like we're supposed to, we're on screens too much. So lifestyle changes, dietary changes, supplement changes can help. But symptoms of low testosterone are, I'm tired. I'm just tired all the time. Symptoms of low thyroid are evening fatigue. Testosterone is also blunted motivation. I know I should, but I don't give a crap. And your kids are like, Mom, how come you can't do that? Like, you used to go do this with us all the time. And you're like, yeah, I don't know. I don't really care. Whatever. It's also low libido. It's muscle weakness. It's not being able to open the jars that you used to open. It's not being able to huck the hay bales or other things that you used to do. It's general aches and pains. Remember that progesterone to testosterone is that bigger, stronger, faster pathway. And you see it more in men. If a man walked into a doctor's office and said, I'm tired, I'm gaining weight, I have no libido, here's your prescription for testosterone. If a woman walks in, you have to prove that your testosterone is low. And when your testosterone is low, you absolutely feel horrible. And no amount of progesterone and estrogen are going to change that unless we take into account the testosterone. And then again, at the root of everything is cortisol. When cortisol is high and you're all amped up, right, it affects the pathway, everything above it. So you crave sweets, you're tired, your triglycerides go up, your blood pressure goes up, everything goes up. Cortisol is the root of all evils. So come see Christine, go hang out in the theta pod, like take a deep breath, do a flow, do meditation, do yoga. I tell my patients, I ask them often when I see them, what sparks joy? What makes you happy? And they're like, I don't know. What did you used to do? I used to paint. Well, how long has it been since you painted? Since before my kids were born. Well, what makes you happy? I joke that running is my Prozac. For me, physical activity gets me excited. Other people, it might be yoga, it might be meditation, it might be crafts, it might be reading books, watching movies, hanging out with girlfriends, devotions, anything. But whatever sparks joy, my husband tells me his job is to spark joy. But whatever sparks joy and brings down that stress for at least 20 to 30 minutes every day, really trying to keep that cortisol down so it doesn't impact this any more than it has to. So, any questions on this craziness that we go through? All right. Well, thank you guys for your time. Thanks for joining us, and have a great afternoon and have a great September.
Thanks, Lorri.